So I'm very pleased to introduce Lloyd Price, who's a health executive in residence, member of the Global Business School for Health at University College London. So Lloyd, I wonder if you could highlight your experiences as a health tech entrepreneur and give us some insights into your involvement in GBSH.
Sure. Well, thank you, Julie, for the invite, and thank you for being part of the healthcare executive residence program. So my sort of entrepreneurial career in healthcare started about 10 years ago. Myself and James started a company called Zesty. The first sort of iteration of Zesty was what we called Zesty Consumer. So it was very much focused on private healthcare and primary care. And really the vision was sort of to be the Expedia or Booking.com for healthcare, to book a last-minute dentist appointment, doctor appointment, physiotherapy appointment, etc. So we did that for about 5 years. Raised quite a lot of money, venture capital, a couple of really good VCs, Qualcomm, Mangrove Capital, and a few others. And then around about halfway through our journey, we started to pivot towards the NHS. And we started to see a big opportunity in outpatients and acute hospitals, and we started to build patient portals, so the ability to give patients basically an application so they could manage and schedule their appointment, view their blood test results, fill in pre-visit, pre-surgery questionnaires, consent to sharing of information, etc. All in all, we did that for about 8 or 9 years. And then in 2020, Induction Healthcare, which is listed on the FTSE AIM, acquired Zesty. So that was sort of the end of the sort of 8 or 9 year experience. Zesty really was 2 companies, so consumer and then enterprise. And then the third one is a company called Hive Health that I started last year, and that's very much looking at cybersecurity for hospitals, really trying to strengthen the protection of devices, users, and networks against cybersecurity threats, and start to build it and link it to clinical risk. So really about 10 years, probably 3 different sort of companies. So yeah, that's the sort of experience. In terms of involvement with GBSH, honoured to be asked to be an entrepreneur in residence along with the 15 or 20 other individuals who've really built and scaled healthcare companies and are also currently leading and CEOs of these companies. In terms of involvement, sort of ranges from, I think in a couple of weeks we're going to sit on a panel, a bit of an innovation event. Then I think we're going to find time to mentor and advise students on certain projects. I believe Jeremy Hunt is opening the school in September, so that'll be exciting to sort of attend that. And then, potentially next year, if there's time and if the curriculum allows, maybe doing a sort of a guest lecture or talking about a specific area. It could be financing, raising investment. It might even be cybersecurity, something like that. But really, really nice varied mix, and looking forward to sort of helping as and where we can.
That's great. Thank you very much. So my second question is about key competences. What do you really need to establish and grow your own business in healthcare, would you say, Lloyd?
Yeah, that's a really great question. I think the short answer is you need a combination of EQ and IQ. I think my big lessons in the last 10 years is healthcare is a very human industry. It is people. It's a team sport. It's lots of groups and teams delivering care. So you really got to win over the hearts and minds of quite a lot of different stakeholders. So you need your EQ and IQ. You need to sort of, quite quickly, win over the room. You've got to clearly explain what you're doing. I think as an entrepreneur and as a business person, you're trying to sell a product or a service, and there's multiple stakeholders and they're all looking at it from different angles. Operational teams are thinking change management processes. The technical teams are thinking integration, APIs, access to systems. The commercial teams are thinking cost, ROI. The CEO is thinking, is this going to take us to the next level? Is this going to address elective care backlogs? Is this really going to start to, make us more digitally mature? Clinicians are thinking, is this safe and effective? Like it's multiple things. I think really to be successful in healthcare, you need to focus on people, then the processes, and then the technology. I think you have to start with the people. You have to really understand everyone's part of what they play, how they actually deliver care, the role they play. You've got to listen, you've got to understand their concerns. Really got to win the hearts and minds of everybody. The second piece is the processes. You can't even start to roll out, deploy your technology or solution until you really understand what they currently do. What are the current rules? What are the current processes? What are the current policies? And I think often entrepreneurs jump over the people and over the processes and head straight to the technology. And I think that's a little bit of a recipe for disaster. So I think it is a pyramid. Start at the bottom with people, then start to understand rules, policies, and processes, and then start to understand how your technology can be applied. Really, and you've got to explain your vision. You've got to explain, that it's a journey. In healthcare, nothing happens fast. The Silicon Valley mantra, go fast and break things, does not apply to healthcare. This is a much slower kind of industry. There's a lot of goodwill, post the pandemic, people want to change. But the nervousness, in my opinion, is not around the technology. It's around those processes. It's around how will it affect people. And I think the other piece of advice I would give any sort of budding entrepreneur is we're really in the business of change. We're not really in the business of technology. What we're doing is changing how care is delivered, blood tests are analyzed, policies and processes are delivered. We are in the change management business. And I think it's taken me a long time to sort of get my head around that. I think those are the sort of key competencies that I would suggest will help you get on your way.
That's really insightful. Thank you. So any advice you'd give to health entrepreneurs about building a client base, I guess particularly dealing with governments and government departments? And I think once we talked about ships, you talked a lot about friendships, partnerships.
Yeah, so no, I'm a big believer in a few things. So one of the first things I'm a big believer is, in the ship. So friendships, relationships, and partnerships. Because healthcare is such a human business and it involves people, I think, you naturally start to spend quite a lot of time with people. So you've got to be able to build relationships. So for building clients and building relationships with government, the public sector, definitely, think about, what can you do first? How can you help people? What favor can you do? What advice could you give? Give into the network first. Don't be seen as sort of taking straight away. So I definitely would do that. And then I actually think it's, funny enough, what I call fear. So funding, evidence, awareness, and revenue. I didn't realize it actually meant fear until I sort of thought about it. But yeah, so to build clients and relationships, that takes money. Okay, healthcare takes quite a long time to understand and network and get in. So the F, funding. You need to make sure you have enough money to last as long as you can to then to start to deploy. Everything takes twice as long and everything costs twice as much. Things like data protection, DTAC, cyber essentials. There's so many systems and processes you have to go through that you need money. The next one, E, evidence. Healthcare is all about the evidence of the impact of what you are doing. Healthcare, they talk a lot about outcomes. Healthcare, they talk a lot about results, success. It's not about the whizzy technology and it's an AI-based blockchain that uses complicated machine learning. It simply either saves lives, improves care, makes things more efficient, makes things more productive. So you've got to really focus on generating evidence. And I think academia plays a very important role here. Healthcare is quite unique, in my opinion, which it has what we call AHSNs, Academic Health Science Networks. And they sit between the NHS and hospitals and healthcare organizations and with academia. You don't tend to find that structure and that very formal relationship in a lot of industries, but in healthcare, academic health science networks, really do that. The A, so awareness. You have to create awareness amongst multiple stakeholders about what you're doing. Don't just focus on clinicians. You need to focus on the execs, CEOs, CIOs. You also need to engage with the technical guys. You need to engage with the finance guys. You understand how we can build an ROI model and a business model. The technical guys, the project managers. You have to be creating awareness. You have to be building bridges the whole time. And then R, the revenue. You have to find a business model that suits the way they procure things. One of the biggest things I think is a challenge for new entrants and entrepreneurs is there are a lot of complicated frameworks, procurement networks. G-Cloud is the central kind of government hub. Then there's a plethora of regional, London-based, Scottish, Welsh. Getting to understand that your revenue model, your business model suits healthcare. Healthcare actually likes to buy things over periods of time. What's quite common is what they call a 3+1+1. So effectively a 5-year deal, 3 years and then a break clause and then ability to renew after year 4 and into year 5. That's quite unique in a lot of industries, you know. So I think the biggest advice is it takes a long time to get your first 1 or 2 deals, but the good news is then it becomes, you know, quite a long-term relationship that you're building. So a lot of the hard work goes up front, and then a lot of the sort of success comes later. Don't come into healthcare thinking it's a consumer play, a whizzy kind of app. It's not TikTok or YouTube or Facebook. You know, this takes a decade, really. You know, 5 to 10 years really to be successful. But yeah, and a million other things. I'm a huge believer in partnerships. You know, I'm a big believer healthcare is a team sport. Really focus on partnerships. One of the hardest challenges you'll find coming into healthcare is access. It's simply access to people, decision makers. It's simply getting your products and service into the hands of people that can make decisions and buy your product. So yeah, access is very important. But yeah, no, I think they're pretty much the main things.
Right, that's very insightful, thank you. And the final question for our MBA health students, what advice would you give them for developing their personal and professional skills, really, I guess, on project management and pitching to venture capitalists and being business owners?
Yeah, so I think yeah, definitely use the mentoring network that's available. There's quite a lot of people, excuse me, who have trodden this path before, so we're well used to the long sales cycles, the technical requirements, the partnerships that often take place, the fiddly procurement. So definitely take advice of the mentors. I would definitely spend a lot of time researching both academic papers, interviewing prospective clients, just talking to other people in the industry. I do a lot of kind of desktop and quantitative and qualitative research. I think doing a program like this, you know, you have wonderful classmates around you. You guys could almost form a team together, become founders, become co-founders. I'm sure you're all going to have different strengths. Some are going to be more technical, some are going to be more financial, some are maybe going to be more product focused. So I think definitely work together in teams to identify opportunities. I think the biggest thing it probably the program will give and areas to focus on is your confidence. You know, the ability to walk in and say, okay, I don't understand everything, but I'm kind of 80–90% there. So let's go and talk to some people and share knowledge and skills, and then we'll get to sort of 100%. And then other areas, I think healthcare is it's a very welcoming industry. You know, particularly if what you're proposing can help them. What's surprised me is how quickly there's a virality and a sort of word of mouth and recommendation. Yeah, I think the NHS is probably the largest village in the world. You know, everyone knows each other. You know, word spreads quite quickly. There's a lot of networks, forums, events where people bump into each other. So, you know, good word spreads fast. You know, if you come in and help people and they say, well, you know, these youngsters have come in with a brilliant idea and we've deployed it and it's really working, then doors will open for you. But again, I think we're back to EQ and IQ. Don't forget how this is a people business. It's people, processes, and technology. You have to focus on all three. So really, yeah, you know, use this time to really think about how you can shape and prepare and then present your vision, your idea, and how will it impact people, how will it impact the processes, and how will it impact the technology. And also now's a great time. I think post-pandemic, we've seen a lot of sort of renewed interest. There is a lot of competition. You know, there are a lot of sort of startups and there's a lot of innovation out there. But people are willing to listen. There's also a lot of central funding, NHS Digital, NHS England. Money is being put aside to really start to accelerate everything. And then we live in a global world. You know, there's wonderful initiatives, Department of Industry and Trade. There's a thing called Healthcare UK. They really specialise in exporting UK innovation. So before you know it, it could be 2, 3, 4 years, and you know your product is of interest to people in Australia, Canada, the US. I've seen it many, many times. So yeah, it can happen. The NHS is a brilliant foundation to launch. London, the NHS, the UK, it's a brilliant foundation to launch a healthcare business. It exports very well. Quite a lot of people have told me the British NHS and the British Army are held very highly worldwide. So if you are a supplier to the UK defence industry, or the UK healthcare industry, you're held in quite high regards. So yeah, I think that's sort of pretty much my views on that.
Very useful advice. Thank you very much for your time, Lloyd.
Yeah, pleasure.